and I'm going to be presenting to you today a nurse therapist named Hildegard Peplau. The purpose of my presentation is to provide historical evolution on Peplau's theory, to discuss major premise and key concepts of the theory of interpersonal relations. The historical revolution of the interpersonal relationship theory is done by Hildegard Peplau. She was born in 1909. She grew up in Reading, Pennsylvania. Her parents was immigrants from Germany. She was the second child of 6 children in her birth order. Hildegard Peplau, she graduated from Pottstown, Pennsylvania School of Nursing in 1931. She obtained her BA in 1943 in interpersonal psychology at Bennington College, Vermont. In 1947, she earned her master's degree and her doctoral degree at the Teachers College in Columbia, New York. In 1953, she became a certified psychoanalyst at William Alanson White Institution of New York City. She received opportunity to study psychiatric practices before obtaining her BA, and she was recommended by a friend to become a camp nurse, and she worked there, and then she later became the camp director, which she was recommended by the college, and to become the college nurse. While at Bennington College, while working there, she was offered a scholarship to obtain her BA. In 1943 to 1945, she joined the military as an Army Corps nurse, and she was a living psychiatric lab of wounded veterans. While at BC and serving in the Army, she studied under Fromm and Sullivan. Fromm and Sullivan were clinical psychiatrists developing theories on interpersonal process of psychotherapy. In the 1950s, she created and taught the first classes for graduate nursing school at Teachers College. She also served as faculty at the College of Nursing at Rutgers University, where she created the first graduate program for clinical specialists in psychiatry. Offered workshops on interpersonal concepts and interviewing techniques and therapy with individual groups and families. She did all this after retiring. She was a very accomplished nurse and psychotherapist. She served as an advisor to the World Health Organization. She also was a visiting nurse professor at many of the universities in the United States and around the world. She served as a consultant to the United States Surgeon General and was also a consultant for the United States Air Force and the National Institute of Mental Health. She also participated in policy lawmaking groups for the United States government. Peplau, once she retired, Peplau helped to create the first European graduate program at the University of Leuven in Belgium. She remained healthy and active after her retirement until she passed away in California. Peplau, she named the stages of an interpersonal relationship. And for those stages, she identified as one being the orientation phase, and the next phase was the identification phase, and the third phase was the exploitation phase, and the final and fourth phase was the resolution stage. The orientation phase she described as the get acquainted phase. This was a phase and a time for the nurse and the patient relationship to be developed, where trust is established and roles are established and begin to be understood. And this is when you will do your assessment. The identification phase begins with the patient to identify problems to be worked on. The patient begins to respond to the treatment and establishes interdependence. The next phase is the exploitation phase, where the client's trust of the nurse has reached its full potential. The patient also identifies and works toward discharge goals. The client takes an active role in making full use of health services, including education. Finally, the resolution stage. This phase, the patient's needs are met. The patient regains independence, mutual termination of the relationship. Because the sense of security has been formed and the patient is less reliant on the nurse, and the patient has increased self-reliance to deal with his own problems. Hildegard Peplau defines nursing as the human relationship between an individual who is sick or in need of health services and a nurse specially educated to recognize and to respond to the need for help. The major concept of this theory, of the interpersonal relationship theory, defines person as an organism that strives in its own way to reduce tension generated by need. It also, during this concept, encourages the nurse to consider the culture of the patient once the patient has become adjusted to the routine. It also defines health as a word or symbol that implies forward movement of personality and other ongoing human processes in the direction of creative, constructive, productive, personal, and community living. She went on to define as a human relationship between an individual who is sick or in need of health services, and as a nurse specially educated to recognize and to respond to the need for help. She also defined in this interpersonal therapeutic relationship the role of the nurse. The role of the nurse can be that of a stranger, a resource person, teacher, leader, surrogate, counselor. Detailing the roles of the nurse, Peplau described the stranger as being one who offers the client the same acceptance and courtesy that the nurse would to any stranger, and that the resource person, which the nurse is, providing specific answers to questions within a larger concept, and also described the teacher as helping the client to learn formally or informally. These are all the detailing of the roles that the nurse plays. The leader, the nurse plays this role, offering direction to the client or group. And as the surrogate, the nurse will offer serving as a substitute for another, such as a parent or a sibling. And as a counselor, she will be promoting experiences leading to help for the client, such as expressing feelings. Peplau believed that a nurse could take on many roles, such as consultant, tutor, safety agent, mediator, observer, researcher. 4 phases of the therapeutic nurse-patient relationship. The orientation phase is directed by the nurse, involving and engaging the client in treatment, answering questions and providing explanations and sharing information with the patient. In the identification phase, the client Work independently with the nurse, expressing feelings freely. And the client will make full use of the services offered during the exploration phase. And once the client no longer needs the professional services during the resolution phase, the relationship will end. Peplau described the initial response to treatment as anxiety. 4 levels of anxiety has been described by Peplau. She described mild anxiety as the first level of anxiety, and she defined it as a positive state of heightened awareness and sharpened senses, allowing the person to learn new behaviors and solve problems. During this level of mild anxiety, the person can still continue to take in all available stimuli. She went on to describe the next level of anxiety as moderate anxiety and described it as a decreased perceptual field. And the patient is only able to focus on immediate tasks only. The person can learn new behavior or solve problems only with assistance. Another person can redirect the person to tasks. In the next level, she described and named severe anxiety and defined it as feelings of dread and terror. The person cannot be redirected to a task and focuses only on scattered details and has physiological symptoms such as tachycardia, diaphoresis, and chest pain. The next level is panic. Panic anxiety is described by Peplau as the patient can involve loss of rational thoughts, delusions, hallucinations, and complete physical immobility and mutiny. The person may bolt and run aimlessly, often exposing himself to injury. The professional identity role of the nurse is described in this theory, and this is one of our NLN BSN competencies. And also, nursing judgment was addressed in the orientation phase of assessing the client's health and situation and development of nursing care plan in the identification phase. Human flourishing was also mentioned, promotion of individuals, group, and family maximal potential. In comparison, Virginia Henderson, she defined the patient as someone who needs nursing care but did not limit the nursing to illness care. Henderson did not define environment in her theory. She did define the role of the nurse as to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery that would perform unaided if have the strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. Each time that a client seeks care from a nurse, this theory is utilized, which is also the nursing process. The process of this theory is utilized in nursing education. Most facilities utilize this theory. Research was done on Hildegard Peplau theory of interpersonal relations by a person named S.F. Bird. This person developed and tested a nursing intervention framework for working with anxious patients. Students developed competency in beginning interpersonal relationships. And another person, D. Hayes, he researched the phases and steps of experimental teaching to patients of a concept of anxiety finding, which revealed that when taught by the concept of anxiety, after the group was terminated. In conclusion,